Hi folks, Dr. Craig Steingraber here again. I felt I wanted to elaborate a little bit more on what I talked about last week relative to pain production. So here we go. It's the most common cause of pain. We have muscles and tendons and ligaments. They're flexible tissues, but they have constant strain on those tissues in virtually everything we do. Constrained postures. Who doesn't sit at the computer for too long? Repetitive motions. Trauma, micro, small traumas or large traumas, create excessive strain on these flexible tissues. Now let me go to this 4% thing that I talked about last week. Let's say for the sake of conversation, we have a muscle, tendon, or ligament that's 1 foot long. You only have to stretch that too far by a ½ an inch and you start changing the structure of those muscles, tendons, and ligaments. So for instance, how many people do this for longer than 15 minutes. That's all it can take to change the structure. This is as common as breathing oxygen. So what happens generally? The muscles and the tendons, some of them can get too tight. Muscles, tendons, and ligaments can get too tight as well. They can become more weak. What happens then? We can eventually create irritation to pain nerves in the periphery. We can decrease the motion nerve signals. And remember, we talked about these different types of nerve signals. The motion nerve signals that go into the central nervous system. Two of the most common ways that we eventually have pain. By far the most common. So there's ways to try to prevent a lot of this. You're never going to prevent it all. You can't do it. But let's say reduce a lot of this strain, and things to do additionally to keep more flexibility, to keep more strength, so we have less irritation to pain nerves in the periphery, and we have more or increased motion nerve signals to the central nervous system. Hope that helps. We'll see you next week.